Welcome to Wednesday's edition of COVID-19. There has been a rebound in daily cases today, raising our tally to the 400 level. Now, this comes amid the transit of vaccines earlier this morning ahead of Friday's inoculation. We have related news lined up later on in the program, but first, the pandemic updates with our Kwon Soa. Now, Soa, do start with the numbers here in the country.
Sure, Sunny. As health authorities have been forecasting, we are seeing a rise in cases in the middle of the work week as 440 infections were reported as of 12 a.m. And we're also seeing a rise in domestic transmissions, now also standing in the 400s. Now, the country's total accumulation of cases is now past 88,000, but we also see quite a big number of new recoveries made in the past day, raising that total to above 79,000. Now, Wednesday's increase is not as bad as the one we saw last week, up to the 600s, but it's also no decline either, making it difficult for the government's planned revision of social distancing measures. Meanwhile, the KDCA said that between December and February, there were some 1,200 violations of social distancing measures. Here are the details.
Violations at nightlife establishments accounted for 678 cases. 157 people defied the ban on private gatherings of 5 or more people. 142 infringements were related to indoor sports facilities, and 58 were linked to places of worship.
And Yoon also noted that movement across the nation has risen by 7.6% last weekend from the previous one, and especially in the metropolitan region, which is still dealing with triple digits figures here in Seoul and Gyeonggi-do province. And also this Wednesday, we see here a rise in Gwangju due to a cluster infection at a call center. And also we have 4 cases out of the imported cases that were from the airport or seaports. And speaking of which, beginning this Wednesday, all arrivals from abroad must submit a PCR test result, a negative PCR test result, of course, and with the rule being expanded to include South Korean nationals. Now, foreigners without this required document will be banned from entering the country, and South Korean nationals will be forced into 2 weeks of self-isolation at their own expenditure.
I see. Meanwhile, so our first batch of vaccines have been transported from a factory to a logistics center.
Yes, Sunny, it's the first shipment of the vaccines here in Korea. Earlier this morning, we see a truck, which we would be seeing now in the video here, well escorted, filled with the first batches of vaccines, enough for some 150,000 people, departed from Gyeongsangbuk-do Province's city of Andong, where Korean drug maker SK Bioscience manufactures AstraZeneca vaccines under a licensing agreement. Less than 2 hours ago, the vaccines were said to have arrived at a distribution center in Icheon, Gyeonggi-do Province. From there on, they will be delivered to medical centers and nursing hospitals on Thursday, and the actual inoculations will kick off on Friday. And also some updates on the Pfizer vaccine. It is seeking approval from the FDA for transporting and storing its products at a higher temperature, which will also be beneficial for Korea here. And it's also getting ready for clinical trials on new variants. Let's hope for fast process on the variant front, because the variants are prevailing in many countries that we see here, including in the US and also many European countries like Germany. And we're also seeing an increase in the global figure this Wednesday at almost 390,000 new infections. And those are the updates I have for now. We're going to expect a government briefing on the vaccination process, so I'll be back in a bit with a summary. Sunny?
All right, so thank you for now. Right, a panel of local medical experts has recommended the use of Pfizer's vaccines on those aged 16 and above, paving the path for a green light from Korea's drug regulator. For more, I have Kim Han-il here in the studio. Welcome, Han-il.
Good afternoon.
So, Hannah, let's begin with this recommendation for Pfizer's vaccine.
Sure. So yesterday, a panel of experts gathered by the Ministry of Food and Drug Safety recommended the use of Pfizer's vaccine on people 16 or older, following the first of its 3 planned meetings. In January, Korea's drug regulator created a panel of experts to conduct a fast-tracked 40-day review of Pfizer's vaccine. Normally, it's a 180-day process, but was cut down to meet the country's timeline for its vaccination program in February. The panel reached its latest decision based on the results of Pfizer's clinical trials, which were shown to be effective on adolescents aged 16 and above. Also, the experts concluded that immunity levels in teenagers should not be different from those of their adult counterparts, and said clinical trial data from adults are applicable to this age group as well. In terms of the overall efficacy of the Pfizer vaccine, this is what a top official at the Drug Safety Ministry had to say.
The review panel confirmed the efficacy of the vaccine, which triggered a more powerful immune response in the recipients compared to even COVID-19 survivors, leading experts to the conclusion that the vaccine offers adequate protection.
So far, a total of 21 countries, including the US and the UK, have approved the vaccine for emergency use. The European Union and 4 other countries, including Switzerland, approved the vaccine on the condition that Pfizer and BioNTech provide additional documents for review. Here in the nation, the government will begin administering the first of 117,000 Pfizer shots on February 27th, a day after the country starts its inoculation campaign with AstraZeneca vaccines.
I see. And staying with the vaccine from Pfizer, Korea's Prime Minister has claimed that Pfizer's vaccines will be the first to be administered on the elderly, I hear.
That's right. During a television interview, Prime Minister Jung Se-kyun said that when it comes to senior citizens, Pfizer vaccines will probably be administered first, not AstraZeneca shots. Although the country will begin its first vaccination with AstraZeneca vaccines, the Prime Minister said they will not be used on people aged 65 and older until more data becomes available. Unlike AstraZeneca, over 20% of the candidates in Pfizer's clinical trials are aged 65 and above, giving them more data on the vaccine's efficacy in the elderly. Until more clinical trial results become available in March or April, the country will delay inoculating the elderly population with AstraZeneca's vaccine.
Right. Now, the new school year is set to begin next week. Hannah, what measures are in place to ensure safety at schools?
Well, Sunny, health authorities are still concerned about reopening schools given the current circumstances, and there will be no delays in the start of the new school year. In fact, officials say more classrooms will be open for in-person learning, and this is why. Take a listen.
We decided to expand in-person learning despite the current situation to offer better education opportunities for the students. We will curb any further outbreaks through rigorous prevention measures. Health and education officials, as well as the families of the students, all need to work together and keep our children safe.
The KDCA stressed that parents had an important role to play, advising them to keep a close eye on their children's health condition in the run-up to the new school year, and have them tested as soon as possible if there are any suspected symptoms. To ensure a safe learning environment, the KDCA urged all teachers to follow strict personal hygiene rules and avoid private gatherings as much as possible. Clearly, we need to focus on prevention, and all schools are being asked to practice proper ventilation and enforce social distancing and mask-wearing rules.
All right, Hannah, as always, thank you for that coverage. I'll see you again next week.
See you then.
Right, on the local front as well, we have a special briefing on the COVID-19 situation here in Korea this afternoon ahead of Friday's launch of our inoculation campaign. First, authorities will address the latest events here in the country with regard to the outbreak, and then medical experts will answer questions on the upcoming public vaccination. Korea's first inoculations with AstraZeneca's vaccines that have been manufactured by SK Bioscience will be offered to those below the age of 65 at nursing homes. Earlier this morning, the authorities began the transit of these AstraZeneca vaccines from their factory in Andong to a logistics center in Icheon. Meanwhile, also this coming Friday, Korea is poised to receive a shipment of Pfizer's vaccines, which will be given to frontline healthcare workers treating COVID-19 patients starting the following day, which would be a Saturday. Now, a panel of local medical experts yesterday claimed Pfizer's vaccine is effective and safe on all those aged 16 and above, including the elderly. Also on the topic of efficacy, preliminary findings from a study in Scotland show AstraZeneca's vaccine reduced hospital admissions by up to 94%. Now, the use of AstraZeneca's vaccines, as Hannah mentioned, on those aged 65 and above here in Korea will be decided after the results of an ongoing study over in the US, including some 7,500 senior participants. We are still waiting for the briefing to start, so perhaps we can take a look at... No, I understand the briefing is about to start, is it? We'll come back to you afterwards with a summary of that briefing with our Kwon-So-Ah.
We have special officials, and this is a special briefing on the COVID-19 vaccines. And we will first hear about the press release and then continue on with our briefing session. First of all, here is Commissioner Chung Eun-kyung. This is a special briefing on the COVID-19 vaccination here in South Korea. Starting from the 26th, we will begin the inoculations at nursing homes and nursing hospitals, and including those who are aged below the age of 65. And on the 27th, we will also be inoculating the vaccines to healthcare providers who treat COVID-19 patients. And in order to ensure smooth transition of these vaccinations, our special committee has been providing the possible guidelines, and we have been distributing this to related ministries, and we also carried out mock drills as well to prepare for our inoculation drive. As we begin our inoculation drive, we need to decide who will be receiving the vaccines, and also before and after the inoculation, any special announcements or any special notifications that they need to remember are as follows. So here are some details that they need to remember before getting the vaccinations. And those all eligible for the vaccination need to check where they will get the vaccinations, and also they need to have the prior meeting with the doctors, and also when they are meeting with the doctors, they need to also mention if they have any allergy against any cosmetics, food, or drugs. So these need to be given in details. And during the first dose of the inoculation, there is a severe possible allergic reaction, so-called the Anaphylaxis. So if you have this kind of reaction after the first dose of inoculations, you shall not receive the COVID-19 vaccines further. And if you have any other related diseases, you need to also delay the inoculation plan as well. And as for the pregnant women and the children, we will be delaying the inoculation until there are sufficient amount of data for these group of people. And as for the first and second dose of these vaccines, we need to also keep in mind that to keep the time between these two distance, we are also recommending about 8 to 12 weeks in between for AstraZeneca's vaccine and about 3 weeks for those of Pfizer's. And also, we will be carrying out these vaccines. And if you have these vaccines for other kind of vaccines, we need to also keep about 2 weeks of a distance. So this is being recommended for all. And here are some notifications for after the inoculation. So if you have any side effects after the inoculation, you need to also, all of the recipients need to stay at the vaccination center for about 15 to 30 minutes. And also, even after going home, they need to monitor their health conditions for about 3 hours. And after 15 hours of monitoring their conditions, if people had previous allergic reactions, we are asking them to stay for another 15 minutes. And also, this after the inoculation, you need to also keep the shoulder area very clean and sanitized. And if you have any fever or other symptoms, you need to also visit a doctor as soon as possible. And as for senior citizens, we need to note that you need to be accompanied by somebody else because it is very helpful so that you do not sit by yourself after the inoculation. And here are some possible side effects, one being a pain, and also there could be rashes as well, and fever, fatigue, headache, and muscle pain, as well as and other similar symptoms could also appear, which are very similar to those symptoms after other vaccines. And these side effects will likely to dissolve during the next few days. And also, if you have a continued pain, we ask you to also take painkillers as well. However, if you have any allergic reactions or if you have high fever and which is hindering your daily routines, you must visit a health clinic and visit a doctor as soon as possible. And if you also have severe allergic reactions, you need to call 119 immediately or visit an ER. And after the inoculation, we have seen one of the major severe symptoms is the anaphylaxis, which is a severe allergic reaction. This is a very rare case, and it is also developed very fast and within a few minutes. So it needs to also be fully prepared for emergencies. And we are also selecting and mobilizing doctors and medical staff who will be monitoring these situations so that they could also be treating the people who show such kind of reactions. So we are also providing these health professionals with advanced training and education, and we are also cooperating with the fire department so that we have our response scheme ready as well. And if you are suspicious of any side effects, please refer to the 누리집 document, and please also have the detailed guidelines and protocols as well. And after inoculation, if any of the medical doctors have been reported of any side effects, you need to report this to our database. And also, please help yourselves out with the 누리집 document, which will be available to all. And in other countries like the UK and US, we have seen some abnormal reactions, widespread reactions, which were, as mentioned before, rashes, fatigue, and pain. And they also have shown about 1 or 2 days after the inoculation and disappeared within the next few days. And we also have seen some causes of some inoculations that have also caused death. However, we believe that there is no proven causal relationship between the two, and we also have rare cases of the anaphylaxis being reported as well. And here are some compensation measures for the vaccines, and according to our Infectious Disease Act, we will also provide a national compensation scheme for any of the side effects that have been occurred after the inoculation. And we will be following the registered residence area, and you need to report to the public health center, which is in your jurisdiction. And within the 120 days after the report, we will be reviewing this by a panel of experts. And as for the compensation, we will be providing the compensation for the treatment cost, as well as the hospitalization, and also the death-related and funeral-related cost as well. And in order to intensify the government's and the nation's responsibility over the COVID-19 vaccines, we will also be expanding the coverage of the compensation from 300,000 Korean won to cover all of the costs going forward. And we believe that safe inoculation is very important, and we ask you to comply strictly with these protocols that we have provided to you earlier. And also after inoculation, even after inoculation, it is very important that we continue to abide by the quarantine measures like wearing a face mask and so forth. And next, we will also have some experts' opinion. And on Friday, we will be beginning our inoculation. And ahead of that moment, we will also like to address some of the curiosities from the public and also any of the safety-related issues of the vaccines. And today, we have the subtitle of the briefing session, and it says that COVID-19 vaccine is the most effective and safe way to prevent COVID-19. Here are our two experts on my left.
Right, now that was our special briefing this afternoon on the upcoming inoculation drive. SOA and Commissioner Chung Kyung had a list of do's and don'ts.
Exactly, do's and don'ts for before the vaccination, during the vaccination, and also after the vaccination. So first off, on some guidelines before you really get yourself vaccinated, make sure to check the time and location of your vaccination schedule, and also whether you have allergic reactions to especially anaphylaxis, which is one of the main ingredients of this vaccination. And if you feel any coronavirus symptoms, you should delay your inoculation. And she also mentioned that as of now, for pregnant women and for children, the vaccination is not recommended as of yet. And also, it is important to abide by the span between the first and the second round of the shots. For AstraZeneca, the time frame is 8 to 12 weeks, and for Pfizer, 3 weeks. Also, you should stay at the vaccination venue for 15 to 30 minutes to monitor whether you have any side effects. And even after that, for 3 hours, people should monitor their situation. Last but not least, there could be a side effects such as pain, rashes, nausea, or fever and fatigue. But this is similar to other vaccination side effects. And she also mentioned that social distancing measures should be abided by even after you get your shot.
I see. All right, so thank you for that.
Thank you.
Right, up next, we bring you scenes of vaccine transit here in Korea as authorities prepare to start public inoculations this coming Friday with AstraZeneca's vaccines, those that have been manufactured by SK Bioscience. Do take a look.
오늘은 이곳 경북 안동에 위치한 우리 기업의 백신 생산 공장에서 국민들께 공급해드릴 코로나19 백신 완제품이 처음으로 출하됩니다.
Hi, this is Shin Se-byuk. Out of 5 COVID-19 vaccines that the South Korean government has secured, the AstraZeneca's will be the first to be administered starting the 26th, and next up would be Pfizer's. So today we're going to check out the vaccine distribution process from storage to inoculation.
26일에는 화이자 백신 11만 7천 회분이 우리나라에 도착합니다. 이 물량은 곧바로 27일부터 코로나19 환자 치료 의료인들에게 접종될 것입니다.
Upon arrival, vaccines will be loaded into special refrigerated vehicles without going through customs clearance. Meanwhile, ordinary shipping method will be applied to the AstraZeneca vaccine that can be kept at normal frigid temperature.
mRNA 백신이라고 하는 플랫폼의 백신의 경우에는 일상적인 환경에서 안정성, 그러니까 스테빌리티가 굉장히 떨어집니다. 그러니까 상온에 노출되어 있는 시간이 길어지면 이 mRNA 자체가 분해되어 버리기 때문에 적절한 효과를 발휘하기가 어려운 거죠. 그래서 아주 낮은 온도에서 보관을 해야만 그 스테빌리티, 안정성을 오랫동안 유지할 수 있습니다.
Once transporting preparations ready, Moderna's and Pfizer's vaccine will be transferred to a logistics center. This process will be escorted by some 11 military and police vehicles. Police commandos and armored vehicles will be deployed in front and back of vaccine transport vehicles.
For a safer and faster distribution, the South Korean government will provide a number of support, such as the shortest air and driving routes, exemption from various tests, as well as triple security. And as for Pfizer's vaccines, upon arrival, they will be immediately transported to here, the nation's only ultra-low temperature logistics center.
Also, the Vaccine Transport Headquarters has come up with a number of contingency plans in case of emergency during vaccines transport.
So before leaving the logistics centers, vaccines will be divided into smaller units and then loaded into delivery vehicles, and then finally moved to the central vaccination center at the National Medical Center in Seoul with military and police escort.
Storage and handling of these vaccines also matter.
실제로 백신을 사용하게 될 때는 화이자 백신의 경우에는 희석액을 사용하도록 되어 있거든요. 그래서 모더나든 화이자든 이 mRNA 백신은 얼려 있는 상태에서 보관이 되어 있기 때문에 녹이는 시간이 필요하고요. 이렇게 이제 녹인 이후에 특히 희석해가고 섞인 상태에서는 그 하루 내에, 되게 6시간 내에 사용하도록 되어 있습니다. 그러니까 이제 그 시간을 넘어서지 않도록 주의해야 하고, 혹시 그 시간이 넘어섰는데 사용하지 못한 백신은 모두 폐기하도록 되어 있습니다.
So this is what the COVID-19 vaccination distribution process is like. The government has completed its vaccination drill and it is doing its utmost effort to make thorough preparations for the upcoming vaccine rollout. Now it is all set to go. Let's just have our fingers crossed and hope for the best. This has been 신세벽.
대한민국에서 이곳 특히 안동에서 생산된 백신이 이제 국민 여러분들께 접종을 하기 위해서 이곳을 출발하는 그런 날입니다.
예방접종이 시작되더라도 감염 위험이 곧바로 감소하는 것은 아니며 안정적으로 집단 면역이 형성될 때까지는 상당한 시간이 필요합니다.
Today, Korea's first supplies of AstraZeneca vaccines have been transported to a storage site ahead of Friday's public inoculation. Now, for more on the vaccination efforts here, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good morning. Good afternoon.
Right. And I also have Dr. Alice Hyung-Tan from Miss Medi Women's Hospital. Good to have you with us, Dr. Tan.
Thank you for having me.
Dr. Tan, as I mentioned earlier, the first batch of our vaccines, AstraZeneca vaccines manufactured by SK Bioscience, have now been stored at a logistics center in Icheon. Tell us a bit about the protocols from now up until Friday's inoculation.
Right. So I just want to say, despite the ceremony and the really tight security, this process of vaccination is actually pretty standard for AstraZeneca vaccine. It's just we're highlighting it and it's getting a lot of media attention. Basically, from the manufacturing plant, the vaccine has been delivered, as you said, to the logistics center in Icheon. From there, the vaccines will be delivered either to convalescent hospitals that have physicians on site to oversee the vaccination process, or they will be sent to community health centers in different neighborhoods around the country. On Friday morning, as you said, is when the vaccinations will start. And as I said, AstraZeneca vaccine is a fairly standard vaccine. So other than the timing and the scheduling, the process itself should be fairly standard.
Right. Meanwhile, Professor Kim, a panel of local medical experts yesterday claimed the Pfizer vaccines are safe and effective on all those aged 16 and above. What are your thoughts on this?
Well, it's a good news, and they included 16 and 17 years old, and also to the elderly more than 65. And the adverse effect is estimated to be mild, only maintaining 1 or 2 days after the injection. And there are some notes from that panel that if a person had a history of anaphylaxis, we need a special care and monitor them more closely. And they give a negative opinion for easing the deep freezing status. And also somebody might want to skip the second dosage, but the panel also gave a negative opinion. So that means everybody should have 2 shots.
Right. Dr. Tan, I mentioned this earlier in the program, but preliminary findings from a study over in Scotland show AstraZeneca's vaccine reduced hospital admissions by up to 94%. I believe the same study claims Pfizer's vaccine cut admissions by about 85%. How do you respond to these findings?
Right, this is very good news indeed, and this study is looking at the real-world effectiveness of the vaccines. We have efficacy information from the phase 3 trials, but now we're seeing how do these vaccines work in the real world. And the study in Scotland, as you mentioned, is part of a study looking into the effects of these 2 vaccines as part of their national immunization program for COVID-19. And the study itself is not designed as a head-to-head comparison study between the 2 vaccines. The result is that both vaccines are highly effective at preventing hospitalizations due to COVID-19, and this also applies to the population of people greater than 80 years old, where the combined vaccine effectiveness for preventing hospitalizations in the oldest population, greater than 80 years old, was 81%. So this is very good news indeed.
Right. Professor Kim, do you foresee global vaccine supplies as inevitably perhaps affecting Korea's inoculation schedule?
Well, every country is facing the same issue, and there will be some problems ahead because this is a totally new situation. And as we mentioned, some of the vaccines has to be stored in a deep freezer. We never used that kind of thing before. Important thing is how we are going to plan and react to those situations. And I think there might be some challenges, such as vaccine damage. If we cannot maintain the cold chain, I mean, something wrong with the deep freezer, or if you run out of dry ice, that might cause some lowering of the effectiveness. And the second one thing is shortage of supply. The manufacturing company will try to do their best, but sometimes we're going to be lack of it. And also shortage of personnel. People are specially trained to vaccinate these special new vaccines, but sometimes we are run out of nurses, and lack of coordination might be another issue. So they try to practice before they start the program, but still that might be an issue. And there might be some gaps in some rural areas. I think Korea is not that serious, but in a big country like Africa, there might be some inequality. And the final thing I want to mention is the mistrust or misinformation about the vaccine. Some people that they think that there might be some conspiracy theory, and sometimes people might refuse to take the second dose if they have a bad experience for the first one. So these kind of things might be a challenge. And at this point, we should have an awareness that all these things might possibly happen and something might go wrong. So we should be proactive to monitor these things, and we have to engage and be prepared for these issues.
Right. Dr. Tan, Britain's GlaxoSmithKline and France's Sanofi have started clinical trials of their vaccine candidate. Can you tell us a bit more about this endeavor?
Right, so Sanofi had a vaccine candidate, but they decided to delay the trial that was being held in December because of lack of it looked like lack of efficacy, lack of immunogenicity. And so Sanofi's protein-based vaccine will now be combined with GlaxoSmithKline's, GSK's adjuvant. And adjuvant is an additive to the vaccine that makes it more powerful, more potent. And so this combined product is now being tested in an early phase trial. 720 adults will be receiving the vaccine in the United States, Honduras, and Panama. And this early phase trial will be looking at the safety, tolerability, and the immune response to this vaccine. If all goes well, then they may be able to move into a phase 3 clinical trial sometime in the second quarter of this year. And if the phase 3 trial goes well, then we may have another vaccine available in this fight against COVID-19 by the end of this year. So this is certainly positive news, something that we need to keep our eyes on.
Right. Professor Kim, from your observation of vaccination campaigns in other countries, what percentage that is of the population needs to be vaccinated or needs to have developed antibodies in order to secure herd immunity?
This is a very difficult question because every country has a different kind of strains that is a pandemic, and the quarantine measures are also different. These all factors affect on the reproduction number. We call it R number. And generally, people understand that more than 70% of the population should have immunity by natural infection or by vaccination to have a herd immunity. But this is an assumption that the R number is about 3, and we estimate that the COVID-19 has a number of R number of 3 if we do not do anything and let it spread by itself. So we must check how is going on in Israel, because they are the most advanced country to vaccinate their own people. I think they reached about almost half right now, and the good news is they already showing that the mortality rate of in the elderly are declining very well, and they say that the effectiveness is more than 95%. So that's the good news. And but if we stop doing our quarantine measures, the R number is going to rise. And we don't have that mutation right now, but if we start to have a spread of the new one called B.1.525, which is common in UK, then the R number is going to increase. So if I assume that we don't have a new strain, and if we continue the quarantine measures as much as we did, if we have a herd immunity more than 56 will be enough. But it's not a definite number, and the more the better. So I hope that we keep on vaccination as more as we can, and keep the numbers as high as we can, so we can finish this pandemic.
Right, and as part of efforts to finish the pandemic, we need to have herd immunity. Dr. Dan, what are the variables to securing herd immunity here in Korea, in your view?
In Korea, so as was mentioned, so there are a lot of factors in place. I think the most important, though, is good uptake in the community. So people need to trust the vaccine, they need to feel confident about the vaccine, and they need to just go and get their arms bared and say, you know, we're going to end it. We're going to end COVID-19. And so I think that is the most important factor. In order to have good uptake, we need really smart messaging, broad-based messaging to the public. And we need to use multiple channels to get the message across to people that they need to go and get vaccinated. I'd like to see not just media outlets, but community influencers, other community leaders, school teachers, pastors, religious leaders, actors, you know, everyone should get involved to sort of get the people on a positive attitude about getting vaccinated, because as was mentioned, the more people get vaccinated, the better it will be in terms of our chances to get herd immunity, and the faster we will be able to get over this pandemic.
Right. Professor Kim, can Korea's vaccine manufacturing capacity perhaps address potential challenges in vaccine supplies?
Yeah, definitely. As I mentioned previously, there are many challenges to have a good vaccine program, and one of them is the shortage of production supply. And if we have it, that's something we already solved. And as the vaccine supply is made by the contract between the company, we should have that good contract. And since we can deal with the product, that means at least we can deliver to those vaccines to the place we're going to give that shots. So I think that's an advantage, and I hope that we don't face any shortage of production. Even though we make it, the company has to follow the contracts they already made. So I don't know the real situation right now, but I hope that we can make enough as we need.
Right. Dr. Tan, what are your thoughts on the government's plans to open school next week? This is also a plan that has been taken up by UK officials. They're also planning to open up their school grounds. We are also planning to open our school grounds starting next week for the new school year. What are your thoughts on this as a doctor?
Right, so there was a study released by the WHO and also the US CDC that seemed to indicate that infections among school-aged children were very mild for the most part, and that we may not need to worry as much about the infection spreading and circulating in schools, acting as a reservoir for the rest of the country. So that's why I think countries around the world are considering opening up schools again, you know, not just in Korea and the UK, but also in the United States and all over the world. I think many parents and also many students take this as good news, because the interruption of school was just, it was so sad and so tragic at many levels. And so giving our children the opportunity to see their friends again, to see their teachers again in a safe setting, I think this is very, very good news. And you know, we will keep our fingers crossed, but you know, we're not doing this, you know, without safety measures. I mean, we have very many layers of safety built into this process. And so hopefully, if everybody abides by the guidelines that we have in place, we will be able to slowly expand the opening of schools more and more.
Right. Professor Kim, I was wondering, what are your thoughts right now on our current COVID-19 situation? We had numbers in the 300s starting this work week, but today we have numbers that have surged by more than 80 cases to 440. What are your thoughts on our COVID-19 situation?
Well, I'm always positive it's going to decline, and since we have a new modality to fight against this pandemic, I mean the vaccination, I'm sure that it's going to end, but if we want to end it more early, we have to work all together. As I mentioned, coordination is very important. Let's say some group of people are following the measures as they did, but if somebody disobey and they do as they wish, there's going to be a new factor, and especially if a new mutant from overseas, if they come into our country, the situation might be different. So the quarantine measures for the people who's coming in from overseas should be maintained as high as we can. And as this coronavirus is easily affected by the weather, I do wish that we can overcome it before this summer, and I wish, this is my hope. Yeah.
Right, and staying with that optimism, Dr. Dan, if we were to seek a further drop in our COVID-19 cases, what are some of the measures we should keep in mind this week and next?
This week and next, so even though we're starting a vaccination campaign, even though we may see decrease in numbers, my mnemonic is MAD HDTV. So remember to mask, remember to avoid crowds, remember to distance, wash your hands, disinfect high-touch surfaces, test early if you have any symptoms or suspicion of COVID-19, and ventilate your indoor surfaces. Just because we start vaccination doesn't mean that we get to forget all of the precautions that we've started and maintained throughout this 1 year of the pandemic. We really need to keep our guard, especially because it does take a few weeks for the full effect of the vaccines to rev in, to kick in. And so I'd like for people to, feel happy and positive, but also just sort of be a little bit well-grounded in terms of their expectations, in terms of what sort of behavior will help us fight till the very end.
Right. All right, Dr. Dan, as always, thank you very much for your thoughts. And Professor Kim, thank you for your insights.
Thank you very much.
Right, we still have a long journey back to normality, and as Dr. Dan, that is, said, do seek to keep prevention at the heart of our inoculation drive. Thank you for watching. See you tomorrow.